Hey, bar. Like a hot boy, y'all tripping. I was in the crib watching Top Boy, chopping up this green. Guess I got a thing for bok choy. Ain't worried. Radius. I don't pay him, but I don't save him. I ain't the glaciers. Need 2 chains like Def Jam to change the glaciers. Titanic crash against flush. You know my wave crazy. Put over with no ID. Look like cocaine 80. Same kid with stripes like a ref's average shirt. Got the next magic verse. Got my chest tatted first. Treasures. Antioch stores make desperate measures. Back when you had a 1-up when your shirt said pleasures. Was in the church like elders. Was underground like shelters. Made a plan to get it and kept it together like welders. I'm living stress free. Never catch me, never test me, oh no. I'm living stress-free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. All black leather now, my vibe much better now. My tribe said I'm the one, my time feel extra now. My instincts dialed in, my senses is dialed up. My sentences chime in, they eyebrows rise up. I feel like a titan writing the scripture. My might is touching the mixture, designing the holy picture. Reminisce on tradition, my fighting the heart with the knockout. Genesis definition of light when God told me pop out. With a smile on my face upon my arrival. It's a difference when racing for your survival. Think I'm poised to win it. Checker flags, waving Nipseyana. Drinking Chardonnay with my little mama banging Rihanna. Icons of this time that we live. I'm facing my every fear. I'm taking time to be still. I'm breaking down every barricade as I wait at the pier. Still waters run deep and I swear it's great to be here. I'm learning patience this year. Chasing greatness this year. I'm making statements before they happen, creating this year. I seen love leave and I seen hatred appear. And my ears adjust to the silence. The snakes I can hear, but it's never scary. The DNA of God hereditary. We all in the same class, but the lessons vary. Old school ambition, but painted extra cherry. Receive the fruits of my labor, I think it's necessary. I'm living stress-free, never catch me, never test me, oh no. I'm living stress-free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. Whoa, 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 whoa. Whoa, 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 whoa.
I see the light, 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 light. I see the reason in the night, 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 night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. And my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low. No love wasted if you take it. If you feel a little lonely, I could use a little something. We could make a new beginning. Feel a little lonely, I could use a little something. Don't give me up, I see the light, 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 light. I see the reason in the night, 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 night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. And my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah,
Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God, with what little pride I can salvage, I'll just pick up and go. Trying to sing to your heart, you went straight for the throat. Know you fronted the bill, but now we divvy the quote. That's time spent with nothing to show. Hard to stomach, I know. Manipulation we didn't need to deploy. But you playing with my vision like you think it's a toy. A product of pain, your demons bleed through the noise. Nothing but a host you sent to seek and destroy. Just a reminder to clear your mind up. This ain't no size up and not a fair fight. Neither the body start to pile up, let's put that behind us. No looking back or looking down, and forever to meet again, it'll probably be on a cloud. It's the principality, love, not keeping count. My default is sugar free, when in doubt, I was bleeding out. Clear the scene, nothing to see. Nobody to blame here but me. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. Just by a show of hands, who could really leave it to chance? Seen some good kids die before Kenny in the van. Grieving on the spectrum, they may never understand. With all that, still sticking to the plan as far as where I land. So aiming for the sky, praying we're aligned. Don't pass me by, I'm alive on the far side. They got the means to move the finish and the start line. So what's a steep fall from a hard climb? So up the mountain I go. No time to explain, I paint it vivid if I make it back home. Bob Ross on every beat, I put the pain in the song. Breaking down the game film, trying to see what went wrong. So the loss matters more than the win. Then living with regret like you didn't pull the pin. Hand grenade in the shade, slow dancing on the limb. For what it's worth, I do it all again. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God.
Wait a minute, feeling kinda lonely, I could use a little something. Room is spinning, wait, I'm living. Feeling kinda lonely, I could use a little something. Don't give me up, I seen the light. I see the reason in the night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. And my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low. No love wasted if you take it. If you feel a little lonely, I could use a little something. We could make a new beginning. Feel a little lonely, I could use a little something. Don't give me up, I seen the light. I see the reason in the night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. Yeah, my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back?
Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God, with what little pride I can salvage, I'll just pick up and go. Trying to sing to your heart, you went straight for the throat. Know you fronted the bill, but now we divvy the quote. That's time spent with nothing to show. Hard to stomach, I know. Manipulation we didn't need to deploy. But you playing with my vision like you think it's a toy. A product of pain, your demons bleed through the noise. Nothing but a host you sent to seek and destroy. Just a reminder to clear your mind up. This ain't no size up and not a fair fight. Neither the bodies start to pile up, let's put that behind us. No looking back or looking down, and forever to meet again, it'll probably be on a cloud. It's the principality, love, not keeping count. My default is sugar-free, when in doubt, I was bleeding out. Clear to see, nothing to see, nobody to blame here with me. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. Just by a show of hands, who could really leave it to chance? Seen some good kids die before Kenny in the van. Grieving on the spectrum, they may never understand. With all that, still sticking to the plan as far as where I land. So aiming for the sky, praying we're aligned. Don't pass me by, I'm alive on the far side. They got the means to move the finish and the start line. So what's a steep fall from a hard climb? So up the mountain I go. No time to explain, I paint it vivid if I make it back home. Bob Ross on every beat, I put the pain in the song. Breaking down the game film, trying to see what went wrong. So the loss matters more than the win. Then living with regret like you didn't pull the pin. Hand grenade in the shade, slow dancing on the limb. For what it's worth, I do it all again. Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God.
Hello, everyone. Welcome to our live webinar. I'm hoping that everyone is able to hear me. If you're able to hear me, if you can just say something on the chat box, if you can just type in anything on the chat box that you guys can hear me, that would be great. Perfect. Thank you, Mom Jenica. All right, so again, welcome everyone. My name is Israel Roman. I'll be your licensed immigration consultant. And we are here today to talk about how do I come to Canada and work as a healthcare assistant, or it could be this one can also be, there's different terms for this one. It could be healthcare assistant, healthcare aide, caregiver, but for now, just for the sake of this webinar, will be all of those terminology would be the same, but we might be using healthcare assistant throughout the presentation. And so for anyone who have any questions, please do not hesitate to add them to ask your questions to the chat box or to the Q&A portion, and also in the Zoom. And we are also live in our Facebook business page. So if you guys are watching through our Facebook business page, I'm hoping that you guys are able to like and share the live streaming to your friends, families, or the groups that you belong to. This would be a very interesting webinar, very informative. You'll learn a lot of things, and I'm hoping that this webinar will kind of change your career for a better. Okay. Let me just turn on my video so that you guys can see me. Okay, there you go. All right. So I am here in Canada right now. Particularly, I'm here in British Columbia, Nanaimo, British Columbia. So once again, I am your licensed immigration consultant, and at the same time, a active registered nurse here in Canada. And we have our two offices. Our main office is here in British Columbia, and we have our office in the Philippines, and this is in JP Laurel Highway, Lipa City, Batangas. So if you guys are close to Lipa City and you guys would like to visit us, we are happy to accept you in our office, and it's in the Sleep City Inn. Our office is in the City Sleep Inn, and it's in JP Laurel Highway, Lipa City, Batangas. So credentials, before I move forward, because I know just like today, maybe like earlier today, someone called me from, where is she from? She's from Edmonton, I think. And she's calling in behalf of her sister, I believe, or her friend or her relative who is back home in the Philippines. And the reason why she called me is that she just wants to, the person in the Philippines would just like to confirm if I am if myself and Roman and Associates is really a legitimate company or a legitimate entity. And that is fair, right? It's a very fair way of trying to make sure that you are dealing with a legitimate person, especially nowadays. There's a lot of scams happening out there, and again, I don't blame you guys, right? So for being very, very protective, right, of your hard-earned money. So yeah, and I totally support that one. And so I'll give you guys I'll make it easier for you guys to kind of like determine if I'm and to really be at ease in terms of our legitimacy. Okay, so as I've said, I am a immigration consultant, a licensed one, and with that one, that means it's a federal law, Canadian federal law, that you cannot give an advice whether it's free or not with regards to Canadian visa if you are not licensed with ICCRC or the Immigration Consultant of Canada Regulatory Council. Again, you need to be licensed with ICCRC before you can give any advices, whether it's free or paid. You need to be licensed. Okay. Now, you can, and so how did I become a licensed immigration consultant? So I did study the immigration policy law, and after completing the course, I did take the, of course, they have their exam, right? And then once I've passed the course, I had to take the board exam and stay active in our regulatory console. So it would be the same if I'm pretty sure some of you guys are registered nurse. So it would be the same as for you guys, right? You take the PSN, then take the RN exam, and then stay active with PRC or your professional regulatory console, right? So same thing. But I don't want you guys to take just my word. Let's go ahead and look at the website. So this is our regulatory console. Again, it's ICCRC, and then you can just click here, verify your immigration consultant. So if you guys are already working with an immigration consultant, you may also do this one, but I'm hoping that you guys will work with me. So just type in the name. So Roman, and first name is Israel, and then hit search, and you'll see in there my name and the contact, and that's my license number, R524540. And when you hit contact, it would say Nanaimo, BC, Canada, and the company is Roman and Associates. Okay. So that's one way of checking if a person is really licensed and it's still active with ICCRC. The next one is, as I've said, I'm with Roman and Associates Immigration Services Limited, and of course you want to make sure as well that that business really exists, right? So you can, again, I'll save you the time. We'll go ahead and go check right here. So this is the Canada's Business Registry. So British Columbia, that's where our office is. Just typing in the name of the company, Roman and Associates, hit enter, and there you go. It would show in their business number, and our location, which is Nanaimo, BC, which is the same as what it shows here, right? And it says active BC company. Okay. Now, the other thing that you can also use is, of course, the search engine, right? So for now, let's go ahead and go to Google. You can Google anyone really, right? So type in, let's say for my name, Israel Roman at Nanaimo. Okay, and let's see what shows up in our search engine when you type in the name Israel Roman Nanaimo. As I've said, I'm here in Canada, BC, so we want to make sure that I'm really saying the truth on that one, right? So if you look at the right-hand side, it would say the company, Roman and Associates. There's 5 stars, so that's good. That's the number, and we're closed at the moment, and we open tomorrow at 8 a.m. Today is actually Thursday right now, August 19, 7:08 in the evening. Yeah, you guys, I know you guys already Friday there, so yeah, Friday morning, so yeah. And you can go ahead and take a look if there's anything, like later on after the webinar, you can do your own search and just see if you can find any red flags, right? And I'm pretty sure you won't find any, but I will leave that one up to you guys to do your own search on that. When we click the images, just want to make sure that the voice behind this webinar is the same as Israel Roman in Nanaimo. All right, so let's go click on one picture. This one right here is myself behind the podium. It says Nanaimo Hospital Auxiliary Donation Tops 300,000. So that's my, yeah. So that's myself right there. We'll go click another picture. That's me, again, holding a big fat check. Unfortunately, that check doesn't come to me, or didn't go to me. It went to the hospital. And let's click on one more. This is myself again with one of our client who just arrived in Nanaimo. Okay. All right, so there you go. So again, the only reason why I'm showing you guys this one is just to make sure that you have the that peace of mind right? And confident where your money's coming from. Okay. All right. We're jumping all over the place. All right. So moving forward. So how to work as a healthcare assistant in Canada. So the question is, I'm a registered nurse here in the Philippines or whichever country. I'm licensed, I'm registered, I've been working for so many years now. I'm pretty sure I am a qualified healthcare assistant. How can I work? That's a very great question. Okay. So first of all is you need to apply for registration with the Health Worker Registry. So this would be under the for BC. It would be the BC Care Aide Community Health Worker Registry. You cannot just come here, aside from the other things that you need, but you cannot just come here and work as a healthcare assistant, even though you're an RN. You have to register with the Health Worker Registry. No one will hire you. Like the hospital won't be able to hire you, or the affiliated facilities won't be able to hire you right now unless you're registered with BC Care Aide. Okay. So what are the requirements then? Okay, that's easy. I can just go ahead and apply, right? So since you guys are internationally educated healthcare professionals or graduates of a program outside of Canada, one of the requirement that would kind of like almost slam the door on you is that you must reside in BC. Okay, so you need to be physically here in BC, not just a visitor, but you need to be at least a permanent resident or a Canadian citizen in order for the BC registry to accept your paper. Okay, so this is a yeah. So I guess for you guys, then you'll say, okay, then this is not for me, right? So what now? There is still a way on how you guys will be able to come here and end up to be working as a healthcare aide. Okay, and that would be with our partner Stenberg College. So Stenberg College with Roman and Associates, that would be your answer in coming to Canada as a healthcare aide. Stenberg College exists, and because of you guys, right? They've done their research on how am I able to help the registered nurses, these healthcare workers who would like to come to Canada and work as a healthcare aide, right? So Stenberg College have done their research in this one, and that's the reason why this program exists. So the best option to come to Canada as a healthcare aide is to apply for a study permit. Okay, you will be studying the healthcare assistant course. You might say, okay, so is this the same as the NC2 training? Actually, not really, right? So the NC2 training, you won't be able to bring that one elsewhere, right? It won't be credited towards if you go to another country, right? It won't be, it's not as comparable as the healthcare assistant course that Stenberg College will provide. If you graduate as a healthcare assistant course in Stenberg College, this one will kind of like qualify you, or it's credited, or it's acknowledged in other countries like the Philippines, of course. So what happens now after I study the healthcare assistant course? So once you have completed your course, then you apply for your work permit. Okay. Once you have applied for your work permit, then you apply for your permanent residency. Okay. Or some other students, what they do is they continue on studying other courses. Like some of the people, some of the clients students who come here, like they study HCA or the healthcare assistant course, but they are also a registered nurse in their home country. So they continue on. They continue on the postgraduate diploma in Canadian nursing. Once they have completed that one, then they pursue their nursing licensure, right? Or some, they go to early childhood education. Okay. So some of you guys would be asking, or our clients sometimes they would be asking, are there any jobs in Canada when it comes to healthcare aid? So this is just hot from the press, right? So I just kind of like took a snapshot on this one. So right now, for British Columbia, there are 117. And the data on this one comes from Job Bank Canada, right? So that means the employer posted their job in Job Bank Canada, but not every employer uses Job Bank. So this is at least, right? So at least in British Columbia, there are 117. In Canada, at least there are almost 1,000 jobs. And again, these are only the employers who chose Job Bank Canada as their way of posting the job, right? So when it comes to the wage, how much does a healthcare aide earn? So this is what you see right now in front of you is the low wage, and then the high end, and then the median wage. So for British Columbia, the median is $22 per hour, and it can go as high as 25. Okay. Now another question that I get is like, how's the job opportunity in the next few years? I'll be studying, but I won't be ready right away, right? Because I have to study, right? So what happens after I study? Would there be a job for me? And the answer is yes, definitely. So as you can see right here, right? So all of the province would give you, has 3 stars when it comes to job prospect as a healthcare aide. The only province that has 2 stars is the Northwest Territories and Newfoundland, which I won't recommend to go there because that is, I mean, like a Northwest Territories, that would be almost, you're close to Santa Claus, right? So you're almost close to North Pole, wherein it's all snow, right? Or it's, yeah, you won't ever, it's always daylight. So yeah, so I won't recommend there, right? Your only client there would be Santa Claus and his wife. All right, so hourly rate for HCA. So earlier I showed you the median, the range, right? So this one is specific to the hospital that I work, which is the Nanaimo Regional General Hospital here in Nanaimo. So I know this is dated May 27th, but I just want to give you the actual, what is a wage? How much does a healthcare aide earn if that care aide is in the hospital, works in the hospital, which is, it is 25.83. Now, you might be surprised, why is a healthcare aide in the hospital? Yes, so healthcare aide can work in a hospital setting. They can work in a private home setting. When they are in the hospital, they are part of the team, right? So they're part of the team of nurses. They do a lot of things in the hospital, right? So for those people who would like to visually see really how much does 25.83 get me in a year, okay? So again, let's say you're earning 25.83 times 40 hours per week. That would give you $1,000 a week. In a month, that would give you $4,000. In a year, that would give you 53,726. If we convert that one to Philippine peso, which is, let's say for now, it is 35 pesos for this webinar, just for the computation sake, I have it as 35 pesos per dollar, but I know it's right now, it's around 40. You will be earning 1.8 million pesos a year, okay? my question to you is that as a caregiver in the Philippines, or as an RN in the Philippines after working for, let's say, 5 years, right? Do you think you'll be close to earning 1.8 million pesos? And I think the answer to that one would be a no, right? And I know that because I came from the Philippines. I came there. I am a nurse also back home in the Philippines as an OR nurse. I won't be earning 1.8. And just recently, I just found a posting for UP Emergency Department. They're looking for a healthcare assistant. Their monthly is 15,000. So times 10 times 12, that's only 200,000. As a nurse, they're offering 30,000 per month. Physician, 70,000. So as a healthcare aide working in the hospital, only 40 hours per week, no overtime, you'll be earning more than what a physician in UP will be earning. Okay. Now, let's say you don't want to work in the hospital. You just want to work in a private setting. You want to look after an elderly, or you want to look after a child, children. Then that's fine as well. What is the wage for a healthcare aide, for a home support worker right now in Canada? The median wage is 16.85. So it's a bit lower than what you'll be getting if you were working in the hospital, but still 16.85 would give you 674 per week, 2,600 in a month, 35,000 in a year, and that would be 1.2 million pesos in a year, working in a private setting, looking after an elderly individual in his private home, her private home, or his private home. Again, you will still be earning more than what a physician will be earning in UP Emergency Department. Okay. And again, this is only straight time hours or no overtime. So what are the advantages in joining with our company, with Roman and Associates? So first of all, we are in partner with the college that delivers exceptional education. And again, they have done all of their research on this one. That's why they have this program just for you. Reasonable administrative fee, 50% on our professional or consultant's fee. No additional professional fee for your spouse and or dependents. No IELTS. I think this is another major question. Is there IELTS? So Mom Jenica will be explaining this one later on in terms of the no IELTS. Job security. I've shown you guys like how many jobs there are. And right now I'm a manager in the Nanaimo Hospital, and I know that there are jobs for healthcare aides like you guys, because I'm constantly looking for healthcare aides. We are constantly short of healthcare aides. Our healthcare aides right now are working, their regular hours is 8 hours, but they are chronically working 16-hour shifts. That's how short we are, right? Multiple options to stay in Canada. So once you have completed your course, you don't have to come back to your home country. You stay here in Canada until you get your permanent residency and get your family here and live here, right? Settle here in Canada. So once again, with our exceptional partner, Stenberg College, and our firm, the Roman and Associates Immigration Services, is your answer to coming to Canada and working as a healthcare aide. And with this, I will go ahead and pass the floor to Mom Jenica.
Hello, good morning, everyone. My name is Jenica, and I'm the Director for International Admissions and Recruitment for Southeast Asia at Stenberg College. Sir, I just can't turn my video on, I think. And then I'm just going to share my screen with you.
There you go. You're the host now, ma'am.
Thank you. Thank you. Okay, let me just prepare this one. Start the video. Hello, there you go. Good morning, everyone. Okay, so again, my name is Jenica, and I will be sharing with you information about our institution. So thank you so much, Sir Israel, for again inviting me over. So what I'm gonna do is share my screen. Just 1 second. My screen is not where it should be. Let me just show it to you. Okay. So I hope you guys can see it. All right, so what I'm gonna do first is play our introductory video. So this is the introductory video of our institution. Okay, and then we'll go through information about our school. So please relax and enjoy the video. So there you have it. So once again, we welcome you to this webinar. We're going to give you information about our institution. I'll share with you the program that will allow you to become a healthcare assistant in British Columbia. And then later on, we'll have our Q&A with Sir Israel. So first, I guess before I talk about our school, Sir Israel gave such a thorough introduction about himself, and that's really good. And I guess a lot of our students also asked me about myself. So I actually am based here in the Philippines with you guys. If you're in the Philippines, I am based here. Our international team is scattered all over, different countries. So we have people who are working in India, people who are working in Mexico and LATAM, in Vancouver, in our campus in Surrey. So we are sort of scattered for the international team. So if you're asking me, I'm actually based here in the Philippines. And as for myself, I've actually been in the education industry for almost 10 years now. For almost 10 years, I've been talking to students, showing them suitable programs for them, and it's a pathway for them to go to a different country like Canada, study, learn the culture, and eventually a lot of them they pursue permanent residency. So that is what I'm here for. I'm going to help you out with a suitable program for you. Okay, and since I am working from home as well, you might hear some background noise, probably from my dog, so I do apologize about that in advance. Anyway, let's get back to our information about our school. So Stenberg College is a private post-secondary college. The school was founded back in 1990 by Mary Jane Stenberg, and we were delivering nursing programs. So our specialty, and we really thrive in delivering medical programs, which is why we're a well-known medical college in Surrey, British Columbia. Now, over the years, we expanded into different industries as well. So aside from nursing programs, we have education, business, and human services. But for today, we'll be focusing on our healthcare assistant diploma program. Now, as mentioned, our campus location is in Surrey. So for those of you who are not yet aware, Surrey is actually a suburb of Vancouver. Okay, a lot of the Filipinos would instantly, recognize Vancouver. So there are sub-cities there, and one of which is Surrey. Now, it's a really great thing to start your journey as an international student in Surrey, because I think most Filipinos would agree they will be saving a lot, because the living cost in Surrey is about 21% lower if compared to Vancouver downtown. So that's a big plus, especially if you are a student. Now, Surrey is also such a great city because it is, there are different races and cultures. So you won't really feel as if you are a foreigner. There's a lot of Filipinos on campus and outside. So we have staff members, we have a lot of students as well, and employees that are Filipinos. Now, the campus or the population of this school would be around still 90% domestic and 10% international. But when I say domestic, I'm just not talking about Canadians per se. There would be other different, races and cultures there. There would be Filipinos there who are already permanent residents. So our campus location is in front of the Central SkyTrain station. So it's a very accessible location. One of the things that we were able to establish over the years is that we have a very strong employer and industry relationship. So this is something that benefits our students, our graduates, something we'll discuss more later on. We also have online learning available, but we'll not discuss that because right now it's applicable to our nursing students. Anyway, once you become part of Stenberg College, we want to make sure that you are successful. And when we talk about success at Stenberg, we're not just talking about your academic success, but we're also talking about your success in terms of your career, okay? In terms of getting employed. And for those of you who wish to pursue permanent residency in the future, we also support that. So there's a lot of different support services in place for you. So here are some of them. One would be your student services. And I think a lot of the DLIs have this as well. So student services would be your go-to department. Whatever you need to tackle, you can just go to student services and they will redirect you to the proper department. They probably would be the first group of people that you'll be speaking with as well when you arrive in Canada. Next, we have career services. Now, career services is really important for international students because they are the ones who help you out, especially for looking for a job as a part-time job, because as an international student, you're allowed to work part-time. So our career services take care of that. If you want assistance with your part-time work, we can definitely help. Career services also invites employers from time to time and there will be some type of activities, and there could be some recruitment activities going on. Now, career services, they also create or organize events or upskilling events wherein you learn how to create or write your CVs properly, your resumes, your cover letters, how to ace your interviews. And these are lifelong skills that you need to have, right? So we have a lot of those types of activities hosted by our career services. We also have academic support. So knowing that you are an international student, there may be some assessments or type of delivery that you need to get used to. So if you need assistance with your assignments, with activities, we can do one-on-one sessions with you. Okay, there will be different types of assessments that can be applied to you. And we also have free classes, especially for communication skills. Now, because you are a student visa holder, we understand that you might need to speak with an immigration consultant while you're there. Probably you're planning ahead. You just need to let us know, okay? And then we will organize that discussion with you. So we have the immigration consultant. We partner with, just like Sir Israel's team, we partner with them so that you can have access to the information that you need in terms of your visa and your future migration plans. In connection to the career services, our programs also have co-op, practicum, and job placement support. So when we talk about co-op, it means cooperative work experience. Here in the Philippines, it is more commonly known as internships or on-the-job training, OJTs. In order for you to complete the program. So our co-op, the good thing about it is that you do not need to look for an employer. We already have our partner employers where we place you. The co-op is normally 20 hours per week. And another great thing about it is that you will be getting paid for your co-op. Okay, so the payment for our co-op is not just an allowance, but as per the industry rates. Now we also have practicum. Normally, there is a practicum before a co-op that usually happens. A practicum is like your co-op, but your instructor will be there right beside you, giving you instructions or giving you feedback for each task that you do, so that you know how to do the task or you know your areas for improvement. We also have our job placement support as well. So as mentioned, you don't need to look for an employer for your co-ops because we will just place you there. And finally, our campus does not have a dorm, okay? We do not have a dorm, but we have accommodation assistance because we have a lot of networks. We can have our network, give us information about possible accommodation for you. So we share that with our incoming students. And then we also partner with homestays. So homestay is a family where they will be hosting your stay basically. They probably have a room that they rent out. And it's a great way for you to really immerse yourself into the Canadian culture because you'll be living with a Canadian family. So that's one way of doing it. You can do it for a month or maybe two, and then you can look for your own accommodation. So it's really up to you. But we do assist our students in terms of finding one. So now that you know who we are, let's talk about the program, the Healthcare Assistant Diploma International with Co-op. So I think Sir Israel has given you a lot of information about this program, about this profession already. There's a lot of terminologies for them. HCAs, healthcare assistant. In some other provinces, they are called personal support worker. In the Filipino term, we call them caregiver. So there's a lot of terms for them. And I think Sir Swell also highlighted there that you're not limited to just taking care of the elders. I've encountered a lot of Filipinos saying, "Oh, I don't want to take care of of the aged, and this is the only work, right, for HCAs." That is not true. You can actually work in a hospital setting, as mentioned by Sir Israel. You can work and take care of children, so that you're not really limited to just taking care of the elders if that's not something that you want to do. But it is such a high demand job, though. Okay? It's a good paying job, and there's high demand in terms of taking care of the elders. Now, this profession is regulated. It means we have the Ministry of Health has established BC Care Aide Registry, and this is where all care aides and community healthcare workers should be registered. And this registration is not just for the sake of registering you, it is also for the sake of serving and protecting the vulnerable patients, okay, the residents, the clients, and providing them the standard that the care providers are able to follow a standard of care for our clients. Okay, so that is really important. You can check the information out if you want to. You can go to cachwr.bc.ca. And there you will see Stenberg College as one of the listed HCA programs in BC. Okay, so we already know the average salary of a healthcare assistant, and these are just some of the places where we place our students during their co-op. Now, let me just share this video with you. This video is, we have 3 students here. They've already graduated. And just so you have a more information, more insight on how to be a healthcare assistant in Canada. So please watch this.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people, you understand, you do this, and this is the rationale for it. And to be able to help the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and From my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But going and coming back is the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs.
Extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confidence that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they're working with another HCA.
Aide called me one day, come for an interview. So, and then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock. I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.
Okay, so there you go. That's our students. They've already graduated. They were absorbed by our co-op partner as well. And as you can see, the background where they were actually interviewed, some of them were in our labs. So the labs that where you will be practicing, it's basically the same with the setting of your work setting. So anyway, this program, okay, let's talk about the program. It's a diploma program. You will be studying for about 20 to 25 hours per week. And when you do the co-op, there will be 20 hours per week. Now, there are additional certificates that you'll be receiving apart from the diploma. So as you can see, there are actually numerous certificates that you'll be receiving as an add-on. Some of them you'll be studying face-to-face, some of them you'll be taking online, right? And these certificates, they complement your profession. The program is just 1 year and 2.5 months. So it's a short program, 1 year, 2.5 months. And within that duration, you will already have 6 months of paid co-op, okay? Now we have the next two intakes is actually October 12. If you're still going to apply for a student visa, I'm not sure if you can still make it, but our next intake will be March 14, 2022. So I think that would be the best intake for you if you plan to study this program, and it should be enough time to process your student visa. Now, the good thing about this program is we have a very accessible program here. So what we're looking for on your academic background is just year 12 equivalency. What does that mean? It means that if you are a K-12 graduate, you can enter this program. If you're a bachelor degree holder and you're from a medical or a non-medical background, you will still be accepted into the program. Or if you're coming from the old curriculum wherein you completed your 4th year high school and then you went to college, as long as you have completed 2nd year of college, that would be your 12 equivalency. No back subjects, okay? I've recently received students saying they've completed 2nd year, but they have back subjects. That is not a completed year 12, okay? So it has to be fully completed year 12 in order to qualify for the program. Now, a lot of you will be asking me about the IELTS. Is IELTS waived? Okay, first of all, if you already have one, academic or general, we will accept an overall score of 6.0, no band lower than 5.5. However, for Filipinos who would like their English waived, we can do that. And this is only applicable to Filipino citizens. You need to submit a medium of instruction in English certificate. You can get that from your previous school, just request it from the registrar. It's just a certificate stating that the medium of instruction in your school was English, okay? Now, because our profession is regulated, you have BC Care Aide Registry, right? You need to be registered. The school may waive your IELTS, but the registry will still require you of an English proficiency. Okay, so what we do in order for us to meet that is we can waive your IELTS to enter into the program so you can enroll. And when you arrive on campus, we will have either CELBEN, CELPIP, IELTS, or TOEFL that you can choose, and you can take an exam. Now, we actually schedule our students for a CELBEN exam. A CLBPT exam. Okay, so it's a language benchmark proficiency test as well. The same with CELBEN, CELPIP, IELTS. So it's CLBPT. That's just $150, which is so much lower than IELTS. IELTS will cost you around $300 in Canada. So $150, that's reasonable. We can schedule that, and we will provide you with the preparation before we have you take the exam. So that is an option for you. Now, if you really want to take IELTS, that is up to you as well. You can do that. As long as you have an English proficiency test done, okay, before we register you. That's the main goal here, so that you can meet the qualification of the BC Care Aide Registry. Okay, so next, the tuition fee. It's already posted there for you. The total tuition fee is for the full duration. It's $15,800, and it already includes your registration fees, your student fees, your finance fees, your co-op placement fees, your material usage, medical coverage for the first 3 months, and your books as well. That is all in. Now, we don't ask for the students to pay for the full total fee. We just require an initial deposit of 5,150 CAD, okay, in order for them to secure their slot. And then the rest of the balance, they can pay that through installment per quarter. We're quite flexible with the payment plans. So if you have a payment plan that you would like to propose, do that, okay, directly to our finance department, and there can be, a discussion whether it can be approved or not. So we're quite flexible with it. Now, I mentioned in the beginning, we are a private institution, and you might ask, will I be eligible for a postgraduate work permit? The answer is no. There will be no PGWP for you. And we're not really afraid to say that, because our program has an immigration pathway. What does it mean? It means that after you complete the program, here are the possible scenarios, okay? Number one is that through your co-op employer, okay, through our co-op partner, you get employed. You get a work sponsorship out of that. And that's what normally happens to our students. Another possible scenario is you don't get a work offer from your co-op, but we have a lot of other employer partners, just like Sir Israel's hospital. So we have a lot of employer partners where LMIA is available, where work sponsorship is available, and we redirect you to that. Currently, the recent graduates of HCA, their main problem is that there are multiple job offers. And that is such a great problem to have, right? And they need to choose one. So that's the current problem. And that's the situation right now. That's the reality of our students. They graduate, they have multiple work offers. Our HCA graduates have 100% employment rate. So this is something that we secure for our students. Once they graduate, they can transition to work visa. And once they have their work sponsorship, they can already apply through different immigration pathways. So they're eligible for it. They don't need to wait for another year or two, okay, to find their employer. They don't have to do that through PGW. Okay, this is a really fast way for you to, for the future if you want to immigrate. Okay, so I'm not going to talk about the admission process anymore thoroughly, because what you need to do is submit your resume to Sir Israel's team, okay, to Roman and Associates. And once you do that, they will be giving you the next steps. But just for you to have an idea, when Roman and Associates submit your documents to us, and if you meet everything, we can give you a letter of offer within 48 hours and make your initial deposit payment. Once you make that payment, send it back to us, we will give you your letter of acceptance, or the LOA, which is what you need in order for you to apply for your student visa. We're almost done. Just one last thing for the COVID-19 readiness plan. We are an approved DLI, so you definitely can travel. A lot of our students have been traveling in the past months, this month, and then in the next few months. The protocols, the travel protocols are continually changing, but we support our students with any travel plans that they have. If there is a need for them to quarantine themselves, we do have subsidy for their food, okay, while they're on quarantine. Or for those who do not need to quarantine themselves, we still organize and coordinate with the students so that we can assist them if they need us during their travels. So there you have it. Thank you very much for listening to me, and I'm giving back the floor to Sir Israel. Thank you very much.
All right, thank you, Mom Jenica. Okay, so now it's time for you guys to give us your questions. Anything that you guys want us to clarify. It's your turn. And again, thank you, Mom Jenica. That was a very, very informative session again. And if you don't mind, if you can give me back the hosting, that'll be great. Thank you.
Thank you. There you go.
Thank you. Okay. All right, let me just check our Q&A and our chat box. Okay, let's start with our chat box. Will this program work for non-healthcare course? Yes, I guess the question is if you are a graduate of a non-healthcare course, or yeah, you have that one. Yes, definitely this one will work, right? So if you are an engineer graduate or architect graduate or HNO, hotel and restaurant management graduate, this course works for you still, right? So it's not limited to those students who have healthcare as their undergrad. Okay. What if I move to Toronto? Will I still be able to use what I study in BC? I'll leave that one to Mom Jenica, because I know in Toronto they use a different terminology. They use patient, no, not patient.
Yeah. Okay.
Support
Yes,
worker.
sir. They actually call them personal support
There you go.
worker in Ontario, and then you have to register yourself in the Ontario PSW Association. That is a completely different process. Okay, because like in the nursing profession, there may be some steps that you need to comply with in order for you to meet the requirements in Ontario. So that is something that I actually am not completely sure if it's going to be transferable. Your education with us definitely is accredited by the BC Care Aide Registry. But then Ontario would have a different registry. So that's something that I think you need to check out for yourself, because we are based in BC. So I'm not as familiar with the Toronto qualifications.
All right, thank you. So next is hello. If ever I'm a resident already in Canada, can I bring my younger sister in the country? I think we need, John May, I would need more clarification in this question. Like, is this related to health care assistant, or is it totally different question? Yeah, so just go ahead and give us more on this one, and I'll be happy to answer that one. But the short answer is no. You're not able to bring your younger sister. Unfortunately, it is only your parents who are able to sponsor the children. So your sister, your parents should be here, permanent resident, and your sister should be less than 22 years old. So that's the general answer on that one. But if that's not the question, please just clarify that question, and happy to answer it. Next question is, yes, I graduated BS Mass Comm. That's good. I'm not sure if it was already mentioned, but is there an age limit to apply? I'm turning 38 this year, so you're still young, but still interested to study. Thank you. So when we look at the immigration policy in the study permit or in the study pathway policy, there is no age attached to any of the pathway, right? That Canada only accepts, or this age, from this age to this age. So there is no age limit on this one. There's no age limit on work permit. The only thing is that we have to make sure that we're able to provide a very, very strong statement of purpose. Why are you coming to Canada and study healthcare aid with your age being 38, right? So what is your plan? And we'll help you with that one, and to create a very strong argument on that one. So, but short answer, age limit, no, there is no age limit. We have students, I mean, like I could see students here that are like 50s, 60s, they're still studying, right? So it's not, yeah, so there's no age limit here. Next is, thank you so much, you're welcome. Is there a format for the detailed resume to be sent? No, there's no format really, right? So just your basic information, your education, your employment, that should be sufficient enough. We don't need to know if you're single or married. We don't need to know your religion as well, that's a common Filipino resume. But we don't need that one. But just your basic information and education, and then your employment experience.
Sir, can I
Go
add
ahead.
to that?
Yep.
Because I look at resumes day in and out, and I think what I noticed for Filipinos is that they fail to put in proper dates, like month and year. Can you kindly just place, even if it's the day is not important, but the month and year is important, because we look at the duration. And sometimes if you're an undergraduate, you have to to identify up until what's the highest academic achievement you've had, because we won't be able to identify whether you qualify for the program or not if you just put in your school's name. So there should be dates. I think that's the only thing I need to highlight because that's always my problem, I think. So thank you, but no format. Thank you.
Sounds good. I am 42 years old. Is it still possible to acquire a student visa? I'm a caregiver and C2 holder. So yes, that is still possible. Again, we just have to have a very strong statement of purpose on why would you like to study caregiving course at the age of 42? What's the plan after that one, right? So where would you use your education after? Okay, how much money do I need to prepare if I will pursue studying in Stenberg? So yeah, so that's a very great question. So basically, you need to be able to show that you are able to pay the tuition fee, right? And also it was mentioned around it's a few hundred more than 15,000. So you need to be able to show that you have that money. And also you need to be able to show that you have enough money to kind of like live and be able to rent and buy your food, right? So in the immigration, it would say 12,000 per year, right? But in our practice, what we tell our client is it would be better to have more than the minimum. So we suggest our clients to at least prepare at least 14 to 15,000 Canadian dollars, right? So your tuition fee, you need to be able to show that one. And then on top of that one, 14 to 15,000 Canadian dollars. Now, maybe the follow-up question on that one is, do I need to have that one on my own account? No, you don't have to. If your parents are sponsoring you or your relatives are sponsoring you, they can have the money on their own bank account. We will just use their profile. So we'll be asking their bank certificate, their bank statement, and the letter of support for that one. Right now, it might, yes, 15 plus 15, 30,000 Canadian dollars. It's not a joke, right? It is very expensive, no doubt on that one. But I look at this one as your investment, and you are investing on yourself, right? So it's not like you're investing in some business wherein you don't know what will happen, right? If it will be a successful business or not, because you have no control over on who's going to buy if you're selling something, right? But this one, you have control over this one on how quick you'll have your return of investment, right? Because you're putting your education on yourself, and in order to have that investment return to you, you have to work, right? So it's on you. So while you're studying, you have the opportunity to start getting your investment back by you're allowed to work 20 hours per week. And again, it's not like because you're a working student, your salary, your wage would be lower. No, it would be at least the BC minimum wage, right? And then after that one, on your co-op or on your paid practicum, you're getting paid as well, right? So you might be getting paid 16 or even more than $20 per hour, right? And then on top of that one, you can still work, right? As part of your study permit. So another 20 hours per week. So chances are, by the time you finish your course in a year and 2 months, your investment is already it's already with you, right? So anything that you earn after that one is just plain income. So that's how I see it. And again, it's better because you are in control on your investment. So yeah. So the other thing to consider now one is if you're trying to get a loan, right? Ask your friends to lend you money. You'll be confident that you'll be able to pay them back. Okay. Next question is how much? That's good. All right. Next question. I mean that I already graduated with the HCA program and got a job in Canada. Oh, Good. And got a PR. Yes, unfortunately, no. I guess this question is related to, am I able to bring my sister with me? So unfortunately, no, you're not. There's no pathway for to bring siblings, right? To sponsor siblings, unfortunately. But what you can do though is you can sponsor your parents, right? Bring your parents here. Once they're permanent resident, then they can sponsor your sister. So there you go. Or if that is not an option, have your sponsor your sister to come here and study in Stenberg College. If caregiver is not the course that she wants, there's other courses that Stenberg offers, and so we can take a look at that one as well. So that's another way of you sponsoring your sister, right? So there you go. Next is, what if I have relative in BC? That's great. Will I still be accepted? Definitely, right? So yes, there's no way in the immigration policy that would say that because you have a relative in BC, we're refusing your application. No. So still, it would go on the same process as anyone else. It doesn't mean that you have a relative in BC or in Alberta, your resume will be approved or not approved. No, it will still go on the usual process. It is good to have a relative in BC in a way that they might be their residence might be close to Stenberg, then your room and board, right, will be shouldered. Then there you go. They can sponsor you on that one. Next is, can I bring my family with me? I guess the question in this one, the family, what we're saying, the only family that you can bring as a student would be your spouse and your dependent children, right? But as an immigration consultant, my advice though is that even though you are able to, and again, it's not 100% guarantee as well, it is better for you to come here by yourself. I know it might be hard because you are going into a country where you don't know anyone. That is a fair feelings, right? But Stenberg College will be there to support you as well. Most of their students are international, so they know how to look after international students, especially those students who doesn't have anyone here in BC, right? So they won't feel homesick, right? So Stenberg College is there for them, for you guys. Now, the other thing is, like, when you come and study, it's not like, no offense to the schools in the Philippines, but there's some schools in the Philippines wherein even if you don't go to class, you'll pass, right? This one is different. You really have to go to class or attend the webinar or attend the online sessions and really pay attention to the course and really work hard to get the mark that you need, right? So you'll be busy. You'll be busy studying, and then you might be busy working as well. So you might not have time for your spouse or your dependent children, right? So my advice is that focus on your study. It's only a year and two. That one will fly very quick. Then once you're done, at least you can now concentrate on your spouse and dependent, right? So your focus will be not divided when if your spouse and dependents are not here. So yeah. Next is OR nurse in full and also a bachelor's holder. Will I exam for entry into the healthcare facility? Will I sit for an exam for entry into your healthcare facility? Hold on. And also a bachelor's holder. Will I sit for an exam for entry into your healthcare facility?
Oh, I actually get what
Okay.
they're saying, Sir Israel. I think because here in the Philippines, before you enter into an institution, you have to do an entrance exam. That is not the case in other countries. I think because, like, for example, I'll just give you an example, Sarah. In the US, they have a national testing, right? And then once you pass that, you go to different universities or colleges. Here in the Philippines, we do not have a national testing for tertiary level. It's a per school. So in other countries like Australia and UK, they have a national testing, which we don't really have. We used to have NCAA, I can remember during elementary, but not on a college level. So to answer your question, no, we do not have an entrance exam to enter into the healthcare program. And when you complete the program, there is no exam to enter the registration. Okay, we facilitate your registration in the BC Care Aid Registry, but you don't need to take an exam for it. The exams that you have to go through would be the assessments per subject. Okay, so those are the exams you'll go through. I hope that's clear for you, Sarah.
All right. Thank you, Ma'am Janica. That makes sense. Okay. All right. So next is, hi, what if I will have a host family while studying? How much would it cost? Thank you. So it would still be the same, but then we can, it can be lower than the 14 to 15,000, right? Or we can just say that the host family will be the one sponsoring you. So it would still be the same, but it would be the host family showing that they're able to support you. And that could be the living arrangement. How long will it take me to finish the HCA program? Is it a year course? It is 1 year and 2 months. Next is from Casey. Is it okay for a relative in Toronto to sponsor me? Quick answer, yes. Also, you have mentioned that my relative can provide bank statement that has at least 15 CAD. Would that be sufficient? Because I will be the one to shoulder my tuition. If they can provide that, do I have to have bank statements as well? It won't hurt, right, to show that you have your bank statement as well. That is fine, but then that is sufficient, right? So your sponsor in Toronto, yes, showing that they have the funds to sponsor you, that 15,000 living expense or show money, that should be sufficient. Sorry. Next is, do you have a pharmacy technician course in Stenberg? Ma'am Janica?
Yes, we do, but not available to international students. So if you take a look at our website, you'll see there's a lot of medical programs there, right? I know a lot of you have checked it. There's medical lab assistant. A lot of you are asking me about the PT. Unfortunately, they're not available to international students. So if you want to pursue that profession in the future, you can enter as an HCA and then eventually study further if that's what you want to do.
Thank you. Next is follow-up question from Casey for sponsorship. Does it have to be an immediate relative? The sister of my auntie's husband might be the one to sponsor me. Is it possible? When we say sponsorship, I guess they sponsor you for your financial expenses, right? If that is the case, then yes, anyone can sponsor you, right? For your study, for the tuition or the living expense. It doesn't need to be a relative. You can be your friend, right? So yeah. Or it could be a bank loan as well. Next is, I have no relative. Oh, okay. Sorry, Riva. So I have no relative in BC. Will I still be accepted? I just need the money to support myself throughout the 1-year program. Yes. You don't need to have a relative in BC. No, in order to get approved. So as long as you're able to prove that you have the financial capability to for your tuition fee and for your living expense, that should be enough, right? Okay, so that is for the chat room. Let's go on the Q&A. From Maria, any form to fill? I guess you are very much interested, Maria, so that's great. So no forms to fill out yet, right? So the first step is to please submit your resume to assessment at romancis.ca. We'll go ahead and take a initial look at it, and then once Stenberg College have approved it, then we'll send you the list of things that you need to submit, plus the form that you need to complete. Next is, can I study HCA even if I'm not a registered nurse in my country? Yes. So you don't need to be a registered nurse. You don't need to have NC2. You don't need to have healthcare aid course in order to be admitted and study the HCA course in Stenberg. The only thing, not only, but one of the requirement for sure is that you're grade 12, right? So I'm not sure if this one was clarified earlier, but if it was, sorry, I guess this one would make it just a reminder. Then if you are a graduate of the new curriculum grade, the K1 to 12, so that's good, right? That's a clear cut. You can go that's one of the requirements. If you were a graduate of the old curriculum, that is only considered up to grade 10. I understand that even though you have your kinder 1, kinder 2, you have grade 7 still, and then you have your high school, that's even more than 12 years of education. Unfortunately, that's not how they count our years of study in the Philippines, right? So right now, that would still be considered you only have up to grade 10. So what happens is that your first year college will now be converted to grade 11. Your second year college is your grade 12. So as long as you have completed your second year college, then you meet the requirement of the post-second, the requirement, which is grade 12. If unfortunately you were in the old curriculum and you only have first year college, unfortunately you won't qualify, right? You don't meet the requirement. I'm hoping that is clear as mud. Next is it possible that I can bring my husband and kids while I'm studying in Canada, because I'm also plan of working and living permanently in Canada? Yes. So the answer in this one, straight answer is there's no rule against bringing your spouse or dependent. But again, as my advice as your immigration consultant, it would be better for you, for your husband, for your dependents to just have you come here by yourself, focus on your study. It's only a year and 2 months. It's just a quick, at least you'll have a break from your spouse. Don't you like that? And once you have that 1 year, 2 years, 1 to 2 years of vacation from your spouse, then you can have your spouse, and that would be a better reunion. I think it would be sweeter at that time. Trust me. Next is, what is the age limit of this program? There is no age limit, right? So as long as we are able to show in the statement of purpose why you're studying HCA course, how would you plan to use the education that you'll gain from Stenberg? You're golden. No need, don't need to worry about the age limit. And another question from Jennifer, can I bring my family? Again, if the family you're referring to is your spouse and dependent, quick answer is there's no policy against it. But my advice is take a break from your spouse and just bring him after 1 year and 2 months. Next question, let's go back to the chat box. Thank you so much for answering all of my questions. No problem, anytime. Are there any requirements my sponsorship need to present? So yeah, so for your sponsor, so basically what what they will need to provide is their employment certificate, right? So just to make sure that the immigration officer would like to see that they're employed or they have a means to provide the money, and then the bank statement, and then the bank certificate. The bank statement would be for the last 4 months, and then the bank certificate. And I think that's it. Did I miss anything, Ma'am Jenica?
I think everything was already covered. Yeah.
Perfect. Okay, now there's one more question. With the bank statement, they want to know if this is safe and secured. Yes, definitely. So don't worry, we won't be sharing whatever you guys submit to our office to Stenberg College. That one remains private and confidential. We won't be spreading that one to anyone. And when it goes to immigration, same thing. That is confidential as well. So no one would know that your sponsor have like $10 million. Don't worry about that one. Canada Revenue Agency won't know that. So yeah, so no one will hunt your sponsor. No worries. It will remain private. I just have to just try to make a strong statement when it comes to, because this has been brought up to me from time to time or frequently in terms of reluctance in applying for admission for Stenberg, because Stenberg is a private school and there's no PGWP. And I understand that there's a lot of things in the website, in Facebook, in social media saying, no, do not accept, do not apply in a school that's private because there's no PGWP. Yes, that is correct. There is no PGWP. But the thing with PGWP or postgraduate work permit is that the reason why PGWP exists is because the government wants the student, as soon as they graduate, the government wants the student to have the ability to stay in Canada and look for a job, right? So that is the reason why they have a PGWP, so that they don't, because once your course is done, your study permit will expire, then you need to go home, right? So with PGWP, you don't need to go home. You have that permit to look for a job. The difference with Stenberg and other colleges is that with Stenberg, you have a paid practicum. The Stenberg College is very well, they're very close with other employers, so they're partner with employers. So even before you graduate, you already have a work permit, so you don't need to go back home, right? So from study permit, then work permit, no need for PGWP. And again, Stenberg College is able to do it. We are able to do it because of their program, how their program is created, which is they have a paid practicum and their relationship with the employers, right? So all of the students that they have are employed right away, even before their study, even before the course ends, they're already employed, right? So yeah, so that is the biggest difference with Stenberg College and other colleges, especially private colleges. When right now, I mean, like there's students coming to our office and asking, can you find work for me? And when I ask them like, tell me more. I just completed my HCA course and now I need to find a job, right? So that's different. With Stenberg, you won't need that one. You won't have that problem because at Stenberg, even before you finish your course, you have your employer. And that's why PGWP is not needed. I'm hoping that that is clear with our 26 participants. Next is how do we need to pay to your company? Okay, so for the Roman and Associates, there are ways. We have our business account in the Philippines. You can do it through there, or you can do it by credit card, or you can do a wire transfer to our Canadian bank account. If your sponsor is from Canada, they can do email interact. That's like emailing us the money kind of thing. For the school, you pay the school directly using Flywire, right? So the down payment for the school, the 5,000, you don't send that to us. You send that one directly, via Flywire to Stenberg College. You won't touch that money. Next is last question, please. Would it be a problem if my sponsor is in Toronto and the school is not in the same area? Nope, that is not a problem. Your sponsor can be anywhere, right? Your sponsor can be in the US, your sponsor can be in the Philippines, your sponsor can be in Dubai, anywhere. Sponsor is in US. What are the to provide? So same thing, right? Wherever your sponsor is, it would be the same requirements. So employment certificate, bank statement, and bank certificate. How about your professional fee? Yes, so our professional fee, that one will be, if you're in the Philippines, it would be easier to just pay it to our deposit it to our business account in the Philippines. At least there's lesser charge. But if the money will be coming from a Canadian bank account, then it could be a wire transfer, or it could be an email interact. Next question from Faye is: the work after the HCA program would be a permanent one or contract basis? So there are some contract, right? That would be for the elderly. If you're working for a private home, sometimes it's a contract, sometimes it's a permanent job. If it's in a hospital or in a facility, it's always a permanent job. There's no contract in a facility, in a long-term care facility, in a hospital, like what we have, let's say, in the Philippines, I guess, right? So it's a 1-year contract, and then you have to renew it every year. No, it's not that way here, right? Next question is, oh, thank you for answering my queries. No problem, anytime. Christine May. All right, I think you're welcome, Faye. I think that's it. Let's give it for 10 more seconds. Got 10 more seconds to speak up. I know there's a lot of information. Your brain might be exploding by now, and that's totally fine. And I know only 20% of what we have mentioned will be retained, and that's okay. That's how people are. No, I won't take that one. No offense on that one, right? So what I'm trying to say is, like, later on after the webinar, if you have any questions, please do not hesitate to ask. We have our Facebook business messenger. You can go ahead and ask there. We have our phone numbers, our WhatsApp. You can send us message over there. You can email us. And yeah, so again, next step is please send your resume to assessment@romancis.ca to start your journey. Great journey. Next question. Oh, actually, if I if I got me confused with the sponsorship, but yes. So even if my sponsor is a friend from the Philippines, that would be, yes, that is correct. So it's sponsored to sponsor your financial needs for your tuition fee, for your living expense. Your sponsor can be anywhere in the world. So yeah, there you go. Any other last few words? Not last few words. Just for this webinar, Jenica.
Oh, okay. Yes, okay. Well, for all the participants today and those who are watching on Facebook, we appreciate your time. Thank you very much for sharing your morning with us. And again, at Stenberg College, we ensure your success. We will secure your success academically and your work as well. Okay, so that's our guarantee to you. You just need to do your part, study well, and we will do the rest. So we would like again to thank you and we look forward to helping you out. And again, for Roman and Associates, thank you so much for inviting Stenberg over once again. Thank you, everyone.
Thank you, everyone. Thank you, Mom Jenica. Stay safe.
Bye.
Bye.